Good day everyone, my name is Maria Gemedici Ocampo from BIT1C FSM. So, our topic for today is about pandemic or COVID-19. What is COVID-19? The coronavirus disease or COVID-19 is an infection disease caused by the SARS-CoV-2 virus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. The common symptoms, we have fever, dry cough, and headache. Fever. Fever is a temporary increase in your body temperature, often due to an illness. Having a fever is a sign that something out of the ordinary is going in your body. Fever is also known as hyperthermia and pyrexia or elevated temperature. It describes a body temperature that's higher than normal. Fever can affect children or adults. Next. Dry cough. A dry cough is a reflex that clears the airways of secretion and irritants such as smoke, dust, and allergens. A cough can be classified as a dry or chesty cough. A dry cough is an unproductive cough where there is no mucus present. A chesty cough is a productive cough where there is mucus or phlegm present. There are two types of cough. We have productive and non-productive. A productive cough produces phlegm or mucus, clearing it from lungs. A non-productive cough, also known as a dry cough, doesn't produce phlegm and mucus. Headache. A headache can affect any part of the head, and pain may be present in one or several locations. Headache can cause various types of pain, and classifying the pain can help a doctor reach a diagnosis. Headache a very common condition that most people will experience many times during their lives. The main symptoms of headache is pain in your head or face. Headache can be treated with medication, stress management, and biofeedback. Next, the reason why the virus spreads. We have A. Because of the people with COVID breath or cough. B. Close contact to someone who has the infections. And C. Because people don't follow the protocols. Okay. A. Because of the people with COVID breath or cough. This is one of the reasons why the virus spread so fast, especially when the virus was just starting here in our country, because at that time we did not immediately know who were COVID positive. So the virus spread quickly and more people become COVID positive. B. Close contact to someone who has the infection. COVID can quickly become infected when you come in contact with someone who is COVID positive. And you can also infect other people you came in contact with you. Many people do not follow the protocols, such as not wearing a mask and face shields, which can cause why you are infected with the virus. It is also often the reason why the virus spread. To prevent the spread of the virus in our country, we follow our protocols and avoid going out of the house if it is not important to do outside. Through that, we can help to reduce the rise of those who become positive in our country. Next, the less common symptoms. We have A. Aches and pain. B. Sore throat. C. Diarrhea. And D. Conjunctivitis. And E. Headache. And lastly, less of taste and smell. Next, sore throat. A sore throat is pain, scratchiness, or irritations of the throat that often worsen when you swallow. The most common cause of sore throat is pharyngitis, is a viral infections such as it cold or the flu. Next, diarrhea. Diarrhea is loose, watery stools or bowel movements. You have a diarrhea if you have loose stools 3 or more times in one day. Acute diarrhea is diarrhea that lasts a short time. It is a common problem. It usually lasts about 1 or 2 days, but it may last longer. Next, less of taste and smell. COVID-19 typically produces a range of flu-like symptoms, including a cold and fatigue, but it can also cause a loss of taste and smell. Taste and smell can return or get better within 4 weeks of the virus clearing the body, but it may sometimes take months for them to improve. That's it for this topic. Thank you.